we're going to dive into ingrown toenails. So if you go to our website, scroll down, you'll see some information about ingrown toenails. So pretty much an ingrown is when the nail penetrates into the skin. All right, so the nail actually grows or penetrates into the actual skin, and a lot of times it's caused by either poor nail cutting, you've had a trauma to the nail, something's fallen on it, foot mechanics, the way that you may be walking, putting pressure on that side of the nail, could be that the toe is hitting on that side of the toe, or bad footwear. And patients sometimes feel a little bit of pain and they try to dig it out themselves, which sometimes can actually make the problem worse. If someone presents with an ingrown toenail that is very mild, and very mild, we're talking about something that may look like this, for example, right? You've got an ingrown toenail, it's very mild. What we try to do is we'll cut that nail and we'll clear that nail from where it's pushing into the actual skin. And a lot of times that can work very, very well. However, if you have ongoing issues with that nail, you have ongoing issues with redness, with infection, or you have issues with what we call granulation tissue, which is a sign of, the area not healing, pus, swelling, you take some antibiotics, it gets better, then you stop the antibiotics, it gets worse again. You cannot keep taking antibiotics for the rest of your life. Pretty much the nail is now larger than the area that is growing, and you get this ongoing issue of ingrowns, and sometimes it just doesn't go away. So that's the time that we discuss doing a partial nail avulsion or a surgical procedure on the nail to clear that nail and stop it from coming back from that area. So pretty much ingrown nail surgery, it's done in-house, it's not done at a hospital, and that involves cutting the nail down to where it grows, putting acid at the base or the root of the nail that we've removed, and stopping that nail from growing back. And it actually has a quite high success rate. We find it's about 90 to 95% success rate. So what does it involve? If this is your nail and this is the area that the nail is growing in, we want to remove this part of the nail, but we just don't want to remove it because even if we cut it out, it will grow back. So what it involves first and foremost is a local anesthetic injection. So we numb the toe on either end, and this is normally the most painful part. Why we don't put numbing cream is because first of all, it won't get to the nerves of the toe, and even if we inject, we're actually going deeper to what the numbing cream can cover. So generally this is the most painful part. What pretty much happens is as the nerves they cross over, that's why we need to do both sides so we can end up numbing the whole toe. So once we inject the toe, we apply what we call a tourniquet, which is a band around the toe to stop the blood so we can work in a bloodless field. We will cut the nail down as minimal as possible. We don't want to take too much of the nail. We'll cut it down to the matrix. Now what the matrix is where the nail grows. So we're talking about this area here. Okay, so under the nail you don't see, but the nail actually comes down under the skin and comes around, and this is the ingrown area, I say, right? So we'll cut down to under the skin where the matrix is, and this is where the nail has its roots and where it grows from. We'll remove this part of the nail. So this nail will be removed from the roots, and even when we remove it, we'll see the actual matrix or the base to make sure that we have the whole nail out all the way down to the base. Then once we do that, we'll get phenol, which is an acid, and we'll pour it in this area. It doesn't affect any other area. We'll pour it in this area, and that will stop the nail from coming back. Then we'll pack it with dressing and we'll close it up. What ends up happening is this skin, and skin is an amazing the way it adapts. This skin will come over, right, and that would be the new area of skin, and that would be your new nail. So pretty much it will look very close to normal, and that's the procedure. Generally 2 to 3 weeks is the healing time. Sometimes people might need to do it on both sides, sometimes more than one toe, and generally you can do that all in one sort of sitting. So pretty much, you know, the procedure in itself, the patient may need to redress. We'll see them 2 days after the procedure to do the initial redress. Then they'll redress for about 2 to 3 weeks. Then we'll see them after 2 to 3 weeks as the final check to make sure that everything is healed. Everything in regards to the process of the procedure is done at the clinic. And so during the initial consultation, what we will do is we'll sit down, we'll discuss all these details and pretty much the best way going forward in treating this actual problem. And the worst case of this, and this is why we advise, you know, not just to keep taking antibiotics, is what ends up happening, the infection. So see that redness there? That's the infection line. So if you realize that a lot of infections, you'll see like an infection line that can actually spread. And in serious cases, rare, but it can happen, you just don't get an infection up the leg, you can actually get an infection into the bone, because on the nail actually tracks down, and if there is a channel, if it finds a way, the infection, it can infect the bone. It is a possibility, or it actually spreads up the foot, and it causes another condition called cellulitis. So foot cellulitis. So this is an example of cellulitis, when the infection pretty much spreads up the foot. Again, we don't see it often because the majority of people will actually get it done or would actually seek treatment before it even gets that far. But that's a possibility. That's why it's important that if you do have an ingrown, the earlier you catch it, the better, so it doesn't become infected and look like that. If it is an ongoing issue, then we need to consider a partial nail avulsion.